You know, as I was thinking of this day, it feels in some ways a lot more like a wedding than it does like it's people from all different parts of my life. People I know, people I don't know, people I look forward to getting to know. But as Fran said, there is this thing that we all have in common, I think. And it's that we all have this passion to make the world a better place. And we all do it in our own ways. Some of us are professional public health people, right? And that's what we do. And others of us are professional human beings. And what we do in small ways or in large ways is we all have this deep urge to contribute to ourselves, to our communities, to the world as a whole. And we have an impact. And I think that's what we're here today to do, is to celebrate that impact that we have, whether we know it or not, whether it's a small impact or a large impact. But those impacts, whether we know it or not, then ripple out into the world. And that's really why our logo is what our logo is. That it's those ways in which what we do to make the world a better place expands out to really have that impact that was our true heart's desire. So with that, let me describe some of what the California Center for Public Health Advocacy does, how we do it, and why I love doing this with all of you as much as I do. So to put some historical context, obesity is not the first public health challenge to be faced in modern times. In the last 100 years or so, this is the abridged list of issues that those of us in public health have tackled. And we have brought to all of these issues a very unique perspective. Whereas medicine and pretty much everybody else focuses on individuals, we in public health focus on whole communities, on identifying what is it that's going underneath the surface and addressing those underlying causes so that the problem doesn't just keep perpetuating itself. From that individual perspective, there's some really simple solutions, or at least at first they seem to be solutions. Let's just educate people more. Let's just get people to take personal responsibility, right? We hear that over and over and over again. Just pull yourself up by your bootstraps and do the right thing. Does it work? Does it ever work? Sometimes, I like being educated. I try to take as much personal responsibility as I can. So this isn't one or the other. Clearly, this is important. But we in public health know that it is not the only thing. We know that in addition to education and personal responsibility, there is also a collective responsibility. That public policy has to play a role. As I've heard it said, public policy, and Fran said too, public policy is the way in which we share and formalize our compassion for the world. That's the role of public policy, and far too often we forget that. But that's public health's role in all of these issues. So in 1999, we were established jointly by the Northern and Southern California Public Health Association specifically to promote the establishment of needed public health policies at the state and local level. And we chose what at the time was not the hottest public health issue. It was, though, a couple years later. This obesity epidemic was soon to be seen as the most important new public health challenge of our day. Important because it highlights these underlying fundamental aspects of our culture that hinder people from being able to live healthy lives all too often. And it affects all demographic groups, but like so many challenges of our day, it disproportionately affects low-income communities and communities of color. Raise your hand if you haven't seen these maps before. There are 4 of you. I keep showing these maps because they are overwhelming to me. This is a picture of the obesity rates in the United States starting in 1985. You can see that in 1985 there were a couple of states that had 14% of adults obese. By 1991, there were some states with 19%. Now we get up to 20%. In 2002, we're up to 25%. In 2006, we're up to 30%. Compared to 1985, where there were some states that had 14%, by 2006, there's not a single state with less than 20% of the population obese. This says this is not only a matter of personal responsibility. There is clearly something else going on affecting the entire country. And the truth is, it's now affecting the entire world. We have become the United States of obesity, but as I said, that's something that we are exporting as quickly as we can as well. It's not just adults, it's childhood obesity rates have gone up 4-fold in the last 40 years. And then I'll describe studies we've done that shows that those numbers are continuing to increase. So what's happening? Big genetic change in the past 40 years? We have less willpower? Are we less informed? Do we need to learn a little bit more about the importance of healthy eating and physical activity? Or have we created a toxic environment? In some ways, we've done a grand experiment, but we haven't known it. It's as if 50 years ago somebody sat down and said, hey, if we completely change the environment, you think we can get 20 or 30 or 40 or 50%, 60% now of adults overweight? People would say, no way. Well, we've done the experiments, the results are in, and I'm here to let you know it's worked. It's been a success. And what's happened?